I wanted to start out with actually a number of issues that all, in my opinion, all tie together into one. And you know, it's kind of stepping off the events here in Portland this weekend. I mean, the guys who showed up in Portland were universally white, and many, if not most, or perhaps even all of them, subscribe to this theory that America is a white nation, that white people should have all the political power, all the economic power, that black people should, you know their place. Well, not just black people, Hispanics. In the case of many of these, these so-called white nationalists or white supremacists, even they include Jews in that list, and Muslims. Their bias is, can be based on religion as well as race, or even gay people they would include in those lists. And this kind of hatred has actually very, very deep roots in the American experience. There was an astonishing study just published in the Proceedings of the National Academy of Sciences. This was a study that looked at the fatality risks during encounters with the police. There were 11,456 fatal encounters with police in this 4-year period from 2013 through 2017. And what they concluded as a result of this, and again, this is the National Academy of Sciences. Now, it's not coming from the Centers for Disease Control, because Republicans have successfully blocked any funding for the CDC to investigate not just police violence, but any kind of killings that involve guns. Ever since the 80s, they've blocked this. So the CDC is clueless. But the National Academy of Sciences looked into this, and what they found was that the 6th leading cause of death in the United States, the 6th leading cause of death, behind number 1, accidental death, number 2, suicides, number 3, homicide, number 4, heart disease, number 5, cancer. The 6th leading cause of death among black men in the United States is homicide by police, killing by police. Now, you see nothing like that in any other developed country in the world, period. But if you're black in the United States, if you're a black man in the United States, the odds are out of every 1,000 black men in the United States, 1 will be killed by a cop. Now, for white men, it's 1 out of every 2,500, 2,500, which is pretty shocking also. But 1 in 1,000? I mean, if I was told that the odds of my getting on an airplane and it crashing were 1 in 1,000, I'd be pretty freaked out. There's 10,000 airplane flights a day in the United States. That would mean, 10 planes falling out of the sky every day. We'd be declaring a national emergency. And that would only be the death of a couple thousand people. But 1 in 1,000, I mean, that's mind-boggling. So what does this mean, and how did we get here? Well, it goes actually even beyond just police killings. A great article in the New York Times over the weekend by Janine Interlandi about, well, the headline kind of says it all. Why doesn't America have universal health care? One word: race. It was, I mean, literally racist senators, mostly in the Senate, many in the House, though, over the years. I mean, ever since the close of the Civil War, when Republicans, this was when the Republicans, there was this brief period of about 15 years where the Republican Party was anti-slavery and very progressive. And then, some Republicans became progressive again between 1901 and 1918. But by and large, those are like the exceptions to the rule. And that's why Republicans like to talk about, we're the party of Lincoln, we're the party of Teddy Roosevelt. Those were progressive presidents. But in any case, at the close of the Civil War, there were calls, and in fact, several states that got taken over, where it got taken over. This is Trump's kind of rhetoric, where a majority of members of the legislatures, I believe South Carolina was one, were African American. In the years immediately following the Civil War, actually proposed, and in some cases even began the process of passing legislation for statewide health care. And there's this book out, it's by Jim Downs, it's called Sick from Freedom. And he lays out this whole thing, that the reason why white legislators over the years have opposed at the state level and at the federal level any expansion of a government health care system was because they didn't want black people to benefit from it. They said, free assistance of any kind would breed dependence. And when that came to black infirmity, that is sickness in black people, hard labor is a better salve than white medicine. Right. This article in the Times writes, it was largely at the behest of Southern Democrats that farm and domestic workers, more than half the nation's black workforce at the time, were excluded from New Deal policies, including Social Security, the Wagner Act of 1935, the Fair Labor Standards Act of 1938, which set the minimum wage and established an 8-hour workday, and the Servicemen's Readjustment Act, better known as the GI Bill. All of them effectively excluded black people. In 1945, when Truman called on Congress to expand the nation's hospital systems as part of a larger health care plan, Southern Democrats blocked that, making sure that the states that received the disbursement of funds could segregate the resulting facilities. Federal health care, they write, it was designed both implicitly and explicitly to exclude black Americans. Access to good medical care was predicated on a system of employer-based insurance, which was difficult for black Americans to get because they didn't have employment at those kinds of places where benefits were being offered. Back in the 1950s, black doctors and nurses were pushing for a federal health care system for all citizens. The National Medical Association, which is like the black AMA, was pushing for this. But the AMA, which was entirely white at that time, it was segregated, was completely opposed to a nationalized health plan. Why? Because it would have included people of color. Even the Affordable Care Act, the biggest beneficiaries of the Affordable Care Act, and here's where we get back to Trump's essential racism and the essential racism in the Republican Party to today. The principal beneficiaries of the Affordable Care Act were people of color. Why? Because they were the least likely to have health care, particularly in the states in the former Confederacy. And what are the states that refused to expand Medicare? Or Medicaid, excuse me? They were the states that had the largest black populations, principally in the South, the former slave states. So, Medicare, Medicaid, and the Affordable Care Act all helped shrink that racial disparity. But once John Roberts on the Supreme Court came up with this theory that he could drill a hole in the Affordable Care Act and allow individual formerly Confederate states to opt out and not have to expand Medicare to the working poor, which were in several of these states, if not majority black, certainly a huge proportion of their state who were uninsured, being people of color, African Americans and Hispanics principally. It's all about race. And then the Republican response, and as a consequence of this, we are getting all of this explosion of white nationalist shooters, white nationalist killers. In fact, the police just shut down 3 of these things. 3 mass shootings that were on the verge of happening. In Connecticut, this kid these are all 20-something white men, expressed interest in committing a mass shooting on Facebook and was trying to buy large-capacity magazines from other states. They found multiple weapons and body armor when they searched their homes and a history of racist and anti-trans social media posts. A Florida man was arrested after sending an ex-girlfriend a series of texts on how much he wanted to commit a mass shooting. A good 100 kills would be nice, he said. Police found hundreds of rounds of ammunition at his home. In Ohio, a man threatened a Jewish community center on his Instagram account with the caption, quote, police identified the Youngstown Jewish Family Community Center shooter as local white supremacist, white nationalist, I'm not going to give his name. And this guy was identifying with him, and he had this cache of weapons and ammunition, all young white men in their 20s. And now we get the memo from the Republican Party. What do we do about this? What do we do about this? The Republican Party says basically, in fact, the question was asked, right? Republican. This is from the Tampa Bay Tribune. Congressional Republicans recently circulated talking points on gun violence that falsely described the El Paso massacre and other mass shootings as, quote, violence from the left. A document obtained by the Tampa Bay Times, sent by House Republicans, asked questions like, quote, why won't you pass legislation to close the gun show loophole in federal law? Why shouldn't we ban high-capacity magazines? Do you believe white nationalism is driving more shootings recently? The suggested response is to steer the conversation away from white nationalism to an argument that implies both sides are to blame. Here's a quote from this Republican document. We cannot excuse violence from the left, such as the El Paso shooter, the recent Colorado shooters, the congressional baseball shooter, Congresswoman Gifford's shooter, and Antifa. Now, by El Paso, they meant to say Dayton. But none of those people, the Colorado kids, the Dayton guy, the congressional baseball shooter, the guy who shot Gabby Giffords, yes, all of them were Democrats. None of them cited their political leanings as justification for the shooting. It was just a coincidence. I mean, they all also probably drank milk. But this, 73% of U.S. extremist-based murders in the past 10 years were committed by right-wing extremists. But the Republican talking point, oh, we've got to worry about mental health. Right.